Hi, I'm Paige Lindred, and the careers I researched are a radiological technician, cardiovascular technician, a diagnostic medical sonographer, and a surgical technician. Each career has their own tasks, college courses, physical demands, working conditions, career preparation, hiring practices, wages, employment outlook, and advancement opportunities, although each of them are very similar. The first career of interest is a radiological technician. They maintain and use supplies to to display the human body on X-ray film. They need to protect the patient and themselves from radiation and exposure. This is very important. They need to know how to operate the machines and have personal skills because this keeps the patients calm and less anxious, which will ultimately result in the patient's cooperation. The college courses required are anatomy and physiology, college algebra, English composition, medical terminology, and medical ethics. The physical demands and working conditions are, because it's in a hospital, they're always going to be surrounded by illnesses, infections, and diseases. They also need to be able to work with needles. There's a lot of sitting and standing and long hours on their feet. Career preparation is just the required schooling. They need to have the degree in it, which is typically just 21 to 24 months, and the certification in the field. Advancement opportunities. Because it is a medical field, they can pretty much advance in anything just with further schooling. They can, especially with the technologists, they can kind of go anywhere within the technologist or technician field. Hiring practice depends on the employer. Some employers expect a lot of experience and some don't need experience. They just want to kind of train you to how they want you to be. The wages are from $40,000 to $70,000 on average annually. And the employment outlook is always very good. Because it is a medical field, they always need these positions filled, and it is a lot of advancement in the technology, so they need people to keep advancing with the technology. And there's job listings all over the United States. There's some in San Diego, New York, Minnesota, all over, because again, it is the medical field and they're always needed. The cardiovascular technicians create ultrasounds of the heart. They monitor patients' blood and heart rate. The college courses required for this, again, are anatomy and physiology, college algebra, English comp, the medical terminology, and the medical ethics. Physical demands and working conditions are, again, because it is the hospital, they're surrounded by illnesses and infections. There's a lot of sitting and standing. They need to be very stable with their hands when they're doing the operations and the examinations. They need to make sure they're not moving, and they need to pay close attention to detail. The career preparations are, again, the required schooling and the certification. And advancement opportunities, they can do anything within the medical field with further schooling and keeping it to like the technicians. They can do an MRI technician, sonography, all of that. The hiring practices, again, depends on the employer. Some want experience where others don't need the experience because they can just train you to how they want. The wages are similar, from $40,000 to $70,000 annually. This one's more around like 44 to 53. The employment outlook is good because, again, it's always growing. The medical field needs these jobs filled constantly. And the next one is a diagnostic medical sonographer. They do ultrasounds of anything on the body. They can do it for babies, for your ribs, your arm, anything really. They're also known as an ultrasound technician. They need to know how to operate the machines and keep the patients informed and calm. The college courses required for this are similar. Again, the anatomy and physiology, college algebra. This one isn't as demanding for the prerequisites. Physical demands and working conditions. Again, it's a hospital. They're going to be around the illnesses, infections constantly, so they need to be aware of that. Lots of sitting and standing and long hours on the feet. Career preparation is the required schooling and the certification and experience. Advancement opportunities, they can advance into, again, anything. Ultrasound technicians can go to technologists. They can become assistants. The hiring practices depends on the employer again. Some prefer experience where others do not, and the wages are from $40,000 to $70,000. This one's typically more in the higher 50s. Employment outlook is good because ultrasounds are going to be starting to replace more of the radiology because people are trying to deflect away from the radiation, so more people will be using that, so they're always going to have to be filling jobs. And lastly, the surgical technologists. They assist during surgery and they prepare the patients before and after the surgery, just kind of making them feel comfortable, asking them the questions for the surgeon, and just getting them ready for it. The college courses are anatomy and physiology, college algebra, biology, chemistry, and the physical demands and working conditions are illness, infection, and disease within the hospital again. Lots of sitting and standing, long hours on the feet, and they are going to be wearing protective gear all the time because they don't want to harm or catch disease from the patient or give it to the patient. Career preparation is the required schooling, certification, and experience. Advancement opportunities, again, it's the medical field. They can advance at anything, especially a surgical technologist. They can advance to a surgical assistant. They can keep going anywhere up in the surgical field just with more schooling. The hiring practices depends on the employers. Some prefer experience where others do not. The wages are again from $40,000 to $70,000, and then this $40,000 to $70,000 in this field is actually a little closer to the $70,000 starting. The employment outlook is good. It's the medical field, so again, they always need these positions filled. And in conclusion, the research helped me sculpt my future and to figure out what I want to do. I researched the tasks, the working environment, the physical demands, the employment outlook, and the advancement opportunities, their wages, and the college preparation. Each career would be beneficial and would always keep me interested. Thank you for listening.